Per Meaningful Use Stage 2, all patients discharged from the ER will be required to have medication reconciliation performed. Those patients admitted from the ER will be excluded as the admitting physician will complete med reconciliation. From within the patient's chart, select the Discharge button. In here, we will click on the prescriptions. This transports us into the ambulatory orders routine. We can either write our new prescription or go right into the med reconciliation routine. It doesn't matter which one we perform first. To do med reconciliation, we must select the Convert button at the bottom of the screen in the ambulatory orders routine. In here you will see the visit medications and home medications on discharge. Visit medications comprise those meds given to the patient during their stay. Their status will always default to no home script, but if desired, you may select New Home Script and manipulate the order accordingly. Home medications will include both their home meds and any new prescriptions that were wrote before entering the med reconciliation routine. Note home medications on discharge have the statuses of discontinue, which allows you to enter a free text reason, resume, or resume and script, which once again allows you to manipulate the order so that a script may be given to the patient. The prescription that we wrote before entering the med reconciliation routine does not have any statuses available. If we do not desire to give this patient a script anymore, we will simply uncheck it. At the bottom of your screen, you will see an Edit All, Resume Home Meds, and Any Order button. The Edit All button is only clickable when you have a status of either New Home Script, Resume, or Resume and Script. This allows you to edit your orders from within a different screen. However, please note, Edit All is not preferred as it requires more clicks. The preferred method of editing any orders is to do it from the front screen. However, if you find you're having difficulties inserting a PRN reason for a prescription, the Edit All button can be used. Please note that when putting in a PRN reason, sometimes it requires 2 clicks to get the PRN dictionary to appear. To quickly do med reconciliation on a patient, the Resume Home Meds button can be clicked. It will do exactly that, so that then you may go into specific orders and discontinue them as desired. Any orders will take you into a different routine to place orders. This is not currently built in our system, so please disregard this button. Once you've completed your med reconciliation, you can click the OK button. From here, it will give you a preview of what you have selected, and then you can click Save and file your orders. If at this point you realize that there is something incorrect and you need to reconcile the medications again, you can always select the Convert button again. Please disregard the Print button, as this information is already included in the discharge packet. If you select Print at this point in time, your changes will not be saved. Notice this patient has no home meds displayed in the home medication list. For these types of patients, if you select the Convert routine, you'll notice you're unable to do anything. The OK button is completely grayed out. That's because in these cases, these patients are already considered reconciled. So unless you're going to write a new script for the patient, there's not much more that you have to do for it. While under the Current Orders tab, we notice that there is something very different about this screen compared to the earlier captions in this video, in that we have red question marks by all of the home medications. And this is essentially letting us know that these medications may have pulled over from a previous visit, however, they have not been confirmed by the nurse that the patient is actually still taking these medications. So they're questionable home medications. That's what this is meaning. These will appear in varying degrees, to which you may see a medication which has all the information filled out for it because perhaps it pulled from a previous visit, or ones in which you're missing bits and pieces of the information, so perhaps only the dose is listed on the medication and you're missing the rest of it. You also have key indicators in your date column letting you know the date that these medications were confirmed. So that's another thing to notice, that if it doesn't align with today's date, then the nurse hasn't confirmed these medications as being the most current. Visualization of these red question marks is really just a cue to you that the nursing staff should be prompted to get the updated home medication list confirmed, so that then you may convert or perform home medication reconciliation for this patient upon discharge. You don't really want to perform it at this point in time because this is not a very accurate list. However, do note that we do have a disclaimer statement listed on our home medication list that we provide to patients on discharge, essentially letting them know that our list is not going to be guaranteed accuracy, that it's only as accurate as the information provided, and that they should still continue to take their home medications as prescribed by their primary care provider. And we do put a blanket statement in there as well, stating that if the emergency department prescribes any new medications, that they should take them as directed and follow up with their primary care provider to let them know of these new medications. At this point in time, it's not to say that you couldn't actually perform the home medication reconciliation on discharge for these patients. It's just that you wouldn't be performing it with the most accurate information. Meditech will allow you to proceed through the routine, and as you can see, these medications, I'll be able to resume all of them as home meds very easily and file this. However, if you want to prescribe any of these home medications as a prescription, you're unable to do so with confidence and will have to fill out the information as you see fit. Now that we've completed medication reconciliation training, let's see how fast we can perform it. Some tips to performing medication reconciliation on discharge: always use the same sequence. So if you're the kind of person that always goes to the discharge button to perform all of your discharge, perform your medication reconciliation from within here so that your workflow is very seamless. So that's always accessing it within the prescription tab right here. Note that there is a difference between the medication reconciliation done on discharge and that of what inpatient does when a patient is transitioning from the ER into an inpatient bed. So if you see at the bottom of your screen something that says something other than convert, then you're in the wrong routine. It should always say convert. Convert's what you do on discharge. If you're accidentally in the order section, you'll see something that says reconcile, and that's what inpatient does. And then you'll always see this screen at the end of any home medication reconciliation. This is the print screen. You can always cancel out of it because it is already going to print with the discharge packet, so you don't need to print it a second time.